Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, super excited to have you here. Welcome. We're bringing some really exciting conversations with real leaders that are painstakingly reshaping the future of healthcare. We're really passionate about a few different areas. We're really focused on improving access, leadership, innovation adoption. And if it's your first time tuning in, let me just sort of take a quick step back and give you a little bit more of the lowdown on what we're really trying to get done here. So, we're focused on bringing real stories of innovation to life, not just the stuff that you read about or stuff that's actually, you know, theoretical. Like, no, this is real stuff, real people that are in the trenches getting stuff done and highlighting their stories, not just the wins, but also a lot of the learnings so that we can ultimately share it with our community and with the world. And if you haven't checked out any historical interviews, because we've done a number of them, wherever you are, if you're watching this, if you're listening to this, please hit the subscribe button now so that anything new comes directly to you. So we are in a very fascinating moment in healthcare right now. Primary care is carrying more weight than ever before. The demands of the system continue to grow. The workforce honestly continues to feel the pressure of those demands. And at the same time, AI is really beginning to reshape what scale can actually look like. And in that gap, the very dangerous gap is actually in rural America. 46 million people, now more than 90% of rural counties facing a shortage of primary care physicians. So rural America has lost more than, I think it was the stat that I've checked was more than 10% of its family physicians in just the last 6 years. And payers who were sort of supposed to serve these communities are quietly kind of pulling out because of less profitability than I think they would have imagined. So the big question is this: can we use technology to expand human capacity without losing the humanity that really makes care work in the first place? And our guest today, John Fryer, has been standing in that gap and is doing something about it. So he is the Chief Growth and Corporate Development Officer at Lumeris. He and his team have helped move over 1 million members into value-based models with more than 10 billion with a B dollars in medical spend under management. This doesn't happen overnight. This happens because there are a whole host of things that are happening, strategic relationships that are in place, and John's CV is pretty friggin' ridiculous. He was named Modern Healthcare's 40 under 40. He is also an active angel investor. And someone that doesn't just talk about transformation, he's proactively building it and building it at like massive scale. So today, um, personally, I want to kind of dig into all of that stuff and look at what's the next generation of primary care going to look like? How can AI really be an amplifier of that? How can they remove a lot of that friction? And, what do health systems need to get right if they want to scale care in a way that is really deeply personal? So, yeah, we're going to go through all of that stuff. So I'm really excited. So, John, great to see you. Welcome to the show.
Michael, it is a pleasure, and I'm super excited to be here today. There couldn't be more going on
Yeah,
in our world, and I think I'm looking forward to digging into it
yeah,
today.
yeah. So we were kind of jamming before the record button went on. I kind of want to start kind of local. So you grew up in Kansas City, Cerner's hometown, now known as Oracle Health, and I think if I read correctly, somewhere along the way you ended up in a random conversation with Neal Patterson that changed the trajectory. Um, I think of your career and your life. I mean, just take me back to that moment. What happened?
Yeah, it's a pretty special, moment, and when you can look back on your life, you can identify these in the moment. You oftentimes miss these
Mm,
opportunities, miss these foundational pivots. But for me, this was a big one. I was a junior in college. I was back in town. happened to get from Neal Patterson the question that many juniors in college get, which is, what are you going to do with your life when you graduate? I was super excited to give him my answer. I had been in economics and a finance undergrad, focus on entrepreneurship, and I was on a very traditional investment banking, financial services track. I had done my internships. I was all excited to be going to Charlotte, Boston, or New York. And I really leaned into sharing how excited I was to Neal, who responded by saying, "Don't waste your life. Go into healthcare and participate in an industry that has an opportunity to truly impact people at scale." And this was almost 20 years ago now, and do so then at a time that could have an impact. And that moment stuck with me. I went into healthcare right out of undergrad. I did get closer to more of the finance side of the
Yeah.
equation for a few years, but
Yeah.
I stayed in healthcare. And it's wild how those chance encounters can have such a broad and lasting impact on your career.
What degree do you sort of attribute that to luck? Like, how lucky do you see yourself? Like, on a scale of 1 to 10, one being not so lucky, 10 being like just ridiculously lucky. Where are you at on that scale?
I think the luck is less having the encounters. It's more seeing the signal and
Mm,
responding to it. I think all of us find ourselves in unique situations or meet unique people or even have a conversation with a loved one. Um, and we don't always listen to it and
mm,
most often don't act on it. And I think I was fortunate to have the experience, but also I haven't really thought of this as to what was it that made me really reflect and make an
yeah.
alternative choice.
Yeah.
But I made that choice with not all the facts in the world, but I was watching the digital health ecosystem start to establish. I'm the son of an entrepreneur, so I've always loved entrepreneurship. There's a bunch of investment capital coming into healthcare around this time, and there was something in that moment that said, "Well, this is the right place for me to focus my energy."
Yeah. I mean, look, you've stayed through your career. You never left. I think there's some people um, with similar profile that would have maybe taken money, gone somewhere else that's a little bit easier. I'm just sort of curious, like what is the thing about this industry that keeps you from leaving, even when it's frustrating and you want to
It's only
run,
for the
into a
foolish.
wall.
It's only for the foolish. No, I mean, uh, I think the thing that there's a lot of challenges in healthcare. There's a lot of
Yeah.
challenges that make um, having a long established career in healthcare really hard, and it's not for everybody. Um, the thing that I love the most is the people that gravitate to healthcare, the passion, the ability to wake up every day with a North Star that you're investing in your future, but you have an ability to have an impact that can actually better the
Mm,
world, better communities. So I think it's part the premise of participating in pushing our healthcare ecosystem that we're all impacted by forward. A large part, the people that get attracted and do stay in it, their passion, they're doing it for, they've got a true purpose. They're generally feel pretty strongly about it. And I think the third thing is to me, it's the land of opportunity. Uh,
right.
there are
Right.
lots of ways that innovators, that passionate people can have an impact at large, big scale, but also at micro scale. I mean, micro encounters in healthcare can have real impacts on real people every day. And I don't think there's many industries that you can step back and, go to sleep after a long day and know it was, I'm
Yeah.
working towards a bigger purpose.
Yeah. I love that. I mean, the metrics earlier were, I'm still like mind over 1 million members, 10 billion in medical spend. Like those are big numbers. I want to go behind those numbers because behind those numbers are strategic relationships that need to all align. You talked a little bit about that. I want to hear about a partnership that was difficult to secure, but you ended up moving it over the line. Like what do those opportunities look like initially? What does it take to get them to get over the line? Take me into that room.
Yeah, I think the way that I have, if you had asked, 23-year-old John, would you be in partnership development and sales? Um, you know, 23-year-old John would have said, no, I'd be in finance, crunching numbers and maybe doing deals on the other side of the table. Um, but I think that partnership development is all about trust. It's all about relationships, and we are in an
Hmm,
AI era that is changing things very rapidly. But um, I think for me and for the culture that I've tried to create on the teams that I've built, it really is about understanding who's on the other side of the table, and you have to do that across the various stakeholders.
that's right.
Um, there's a lot. The one beautiful thing about healthcare is it's consensus driven. It incorporates leadership, finance, clinical, patients, consumers, payers, providers. It's complicated, and we have a very complicated operating model we organize within. And so you really have to understand the perspectives of others, what motivates them, what determines how they view success, how do you keep their communities that are being served top of mind, and really being able to get way lower than the glitz and glamorous sales presentation or technology demo.
Right.
There's a value to that, and it's fun doing a glitz
Hmm.
and a glam show. But ultimately, to scale innovation, you've got to really understand both sides and align at a much deeper level with where am I trying to go? Where am I trying to take our business? What impact do
Right.
we want to have? And does that map with the problems that you need to tackle and the communities that you
Right.
need to serve and the priorities that you have? And it's also putting, the one thing that I've always leaned into with my teams in business development, in any opportunity, you have these moments where you identify something and you're like, oh, I want to bury that.
Right.
I want to put it behind me. I want to put it underground. I don't ever want to bring that up. And that's the wrong way to think about it. When you identify those hairy objects, you need to put them on the table, and you need to put them on the table as early as you can, because you may be able to get that relationship across the line. You may be able to get your deal. You ultimately won't be successful because partnerships are built on trust, integrity, transparency on both sides.
Right.
And I expect and demand that of myself, my teams, but also I expect and demand that from those that I'm looking to be in business with.
Hmm.
Partnerships are not easy. And there's always moments of friction. And if you don't go into a partnership with the ability to deal with those moments in time, you're probably not going to be able to deal with them when they inevitably will come up in the life cycle of your partnership.
Yeah, that just reminds me of my father-in-law has been a really big mentor for me, and he always said that, if you're going in a partnership, pick a fight. How does your partner fight? Do they fight fair? Do they get really nasty? See how they respond, how they react. Curious, when you're working with health system leaders at this type of scale, what's usually their readiness to change? Because it just seems as though, like within the last few years, there's been sort of this, yes, value-based care. We talk about it a lot. Not as many are doing it as we're talking about it. What's the readiness to change? Where do you see their aperture for wanting to make a move? Like, what has to happen in order for them to really consider this?
I think that we're at a pivotal moment in time in healthcare. There is change coming at us in all directions, and I think
Hmm.
value-based care is one mechanism. The transformation of AI is another. The reality that we don't have an innovation problem in healthcare. We have a
That's right.
deployment, execution, and operating model problem. And I think when you think about how ready are we, the answer is it depends. I
Mm,
think by and large, most of the leaders that I engage with in a one-on-one setting understand they want to drive change. They believe in the future. They're
yeah,
optimistic. The difference is, and what I seek to find, is those that have the fortitude to not only identify the need for change, the desire for change, but they've got the innate ambition and belief that they have to change, that they can lead cultural change. Change management is not for the faint of heart. Um, Moving people from the status quo, even moving people, to think differently about an individual task in their daily job is very
right.
difficult. To think about whole
Yeah,
scale redesigning how our patients experience care. Now you're blowing people's minds, and it takes a leadership profile, a leadership commitment, and also an organizational culture to be successful in that. And I think my optimistic side does believe that more of those cultures exist today than existed last year, than existed 2 years ago.
yeah,
Um, but as I look back over a decade, those cultures are really hard to find because they're very hard to create. They take years to create
they
those
do.
cultures. And we
Hmm.
don't have years uh, to solve the challenges that are in front of us. And I am a big believer that the way the winds are blowing right now, whether it's the demands that our aging population is putting on our healthcare delivery system, the rise of chronic diseases and the prevalence of chronic disease across our populations, the state of our funding models. As more people age, they're moving into government programs. Government
Hmm.
programs pay our providers less. Employers are, facing 10% year over year increases in offsets for costs. And so I think, all of that to be said, I think change must happen, change can happen, and those that will themselves and their organizations to find good partners to help them in a transformational journey will ultimately be the sustainable, the successful, those that'll be able to carry on their missions that in many cases in healthcare have been around for 100+ years. There are
Yeah,
providers. You brought up the payer segment of our
yeah.
industry and their ability to come in and out of markets. Um, from a business perspective, they have an ultimate advantage. They can come in and out of a market on an annual basis.
Hmm.
They can choose the employers they partner with. They can choose the counties they offer government programs within, and they can pull the plug on a year-over-year basis. Providers are entrenched in our communities. And in many
That's
cases,
right.
again, they have been there for, in some cases, hundreds of years with a mission and a vision of caring for the people around them. Um, and it is increasingly tough for them to continue to see what does 3 years from now look like? What does 5 years from now? How does my mission and my vision continue to sustain with all the potential headwinds that face folks?
Yeah, I mean, if you think about from a provider perspective, there's certain things that we know aren't going to be changing anytime soon. I mean, from a patient's perspective, when they want to go in to see a provider, they want to go in and they want to be seen pretty quickly. They're not going to want to be seen like, hey, I want to go see Dr. So and so and see them in 6 weeks from now. Like they want to go in like tomorrow, if not sooner, whether that's virtual or in person. They always are going to want to be treated nicely. They're not going to be like, you know what, I wish I would have gone there and gotten treated like shit. Just
We're
it's not
not
going to
very good
happen.
at that, though. We're not very good at that.
And then clinicians want to work atop a license and they want to work at a place where they feel valued and they feel respected. Like those things aren't going to be changing. Does Lumeris? operate off of, specific principles catering to that? And if so, what does that dynamic look like?
Yeah, it's a really interesting question. So, Lumeris is a company founded by physicians 20 years ago that were fed
Yeah.
up with their status quo and really leaned in as physician entrepreneurs to do something about it. And that led to the journey that became Lumeris and became this incredible organization I've had the pleasure of serving for more than 9 years now. Um, and when I think about that history, originally, company really had designed around enabling the physician and from the
Yeah.
physician's perspective and the physician and the care team's perspective, building tools to better enable that physician and the care team. And I think a lot of our history was very focused from that lens. Um, but I would say as we've endeavored to tackle an even bigger problem in solving access and
Yes.
expanding access to care, um, probably 2.5, 3 years ago, we did step back and say, for us to do this the right way, we need, as an enterprise, as an organization, to make our commitment be to build the model around the patient and start with the patient and then go to the physician and the care team and then go to all the other components around the equation. And I think it changed our perspective. And
Hmm.
we've come into our conversations, and it's
How,
not
wait,
to
how
say,
so? How so? Did it initially,
I
completely
think
change it
that,
or?
we come in to conversations today. We are a clinically driven organization. We have strong clinical
Yeah.
leadership throughout the company, strong clinical leadership in our core product and in
Hmm.
our engineering teams. And what we are building, the clinical rigor is of the utmost importance to us. But I got a good chuckle the first time I heard this. Our chief clinical officer, Dr. David Carmouche, in a room full of physicians says, I just want to be clear. We've built this product from the patient's perspective, not from my perspective or your perspective. Now, obviously, we've been very intentional with the design that it has to um, absolutely enhance the quality of life for clinicians, give them more control, give them more visibility, allow them to believe that their patients are getting better care. Um, but when you design a system
Hmm.
around it's not the end consumer because they're not buying my solutions,
Yeah.
but they are the ultimate. If we are successful, who wins? It's the individual people that have better care and a more coordinated experience, and they identify symptoms earlier, and they've got access to care quicker, and their care is more coordinated. um, and so that's another interesting part about healthcare is like many times like that is the end user I want to impact the most, not my customer. It's not who pays uh, the bills. um,
Mm.
but that's who we've designed around, um, with a focus on the care teams, but really putting that patient experience in the center, because that's going to be the only way I think we achieve our objectives of scaling access to provide
Mm.
primary and preventative health services.
Because look, I mean, the entire industry is like talking about AI right now. Um,
A lot of talk.
but yeah, but most of the conversations are around like efficiency and cost. And it just sounds as though like you're operating in a world where the relationship between the patient and the physician is the whole product. So I kind of want to ask you something different. I mean, where where have you actually seen AI make care feel more human
Hmm.
rather than less?
I got a couple of early. We saw these early on. One of which I think we
Hmm.
went into it expecting. The other we had a major aha moment. When you think about getting ready to go to the doctor, we all do it. We, like you
Yeah,
mentioned, may wait weeks to go see them, and we've kind of got our laundry list of things we want to get. We got finite time,
yeah,
and I want to make value out of this driving and parking and waiting, getting that time. I've got my list of questions. 9 out of 10 times we definitely forget most of what we wanted to bring up in that
Yeah,
conversation
yeah,
in the moment because it's like time pressured and maybe
yeah,
the clinician says something and we forget to ask. And so what happens is we go home and then we have to call the office and then we're asking our questions and then we're waiting to get responses. Really low hanging fruit was understanding what a patient wants to discuss before they're in the room and surfacing that to the provider. And so AI doesn't forget things. It can have conversational experiences with you very much like a human. Listen, understand, notate, and then put it in front of that clinician. So actually, our clinicians are seeing patients coming in. Here are the four things they're really interested in understanding. And that gives the provider a perspective as to what's top of mind for this patient right now. Because in the old model, they're looking back at charts, they're digging through, last
right,
conversation. Dr. David Carmush, again, another story about him is he used to write down the first time he met someone, what's their dog's name, what's their kid's name. So they're trying to personalize it. But
right.
they're looking back at their file before they walk in. They're seeing 30 patients a day. Uh, they're writing it down and trying to bring those human components into it. And so the models and AI can actually deliver a more personalized human experience. I'm still focused on the human,
Yeah.
the physician and the patient in-person visit, but it's humanized, it's tailored, it's personalized, leveraging AI. I think the other um, when we first started rolling out AI to consumers and patients,
Hmm.
big scary moment. I said, "Oh boy, are people going to interact with these things? Are they going to reject them? Are they going to hang up? Are they going to, write a newspaper article about how horrible this experience was?" Um, it was an existential moment for me. Waiting to see this kind of play out. And one of the first, individuals that our platform interacted with was a 90-year-old woman, Medicare Advantage patient.
Hmm.
Um, and we noticed we're doing constantly looking across surveillance and we've got products that we've built to make sure that the experiences patients are having are both clinically relevant, clinically safe, experiential, and understanding how people respond. And we noticed that this lady was spending a lot of time on the phone with an agent. Our conversational agents announce I'm an AI assistant calling on behalf of their provider. So we are very upfront that you are talking to software.
Hmm.
Um, and this individual was spending 40 plus minutes on the phone with the agent. And this was early on in our journey. And so we were having care team members call these patients after they were interacting with the AI to ask, how was it? What did you like? What did you not like? And in this case, when we called, we got a hold, her daughter picked up the phone. Her daughter did not
Right.
live in the same city
Okay.
as her mother. She was actually in town ferrying her mother to doctor's appointments. And she said, what you don't have visibility into is that phone call may have been the only interaction my mother had that week. And so for us, at that point, this was, I don't know, 18 months, almost 2 years ago, we hadn't even thought through the loneliness component,
Yeah, I mean, just
uh,
isolation in general.
the isolation, the loneliness, a bit of a sad, experience that we took in there, but at the same time, really exciting. But also it really made clear to me like the responsibility we bear. Um, and the impact these technical tools will have on all of us um, is really powerful, and we've got to not take that lightly. And I say we as an industry,
Right, right, right.
um, because I think the pace at which the market solutions, the hyperscalers, you name it, is moving. Um, is really, really fast. And the downstream implications, like these are just micro examples of, um, big downstream implications and big responsibility I think we as an industry have to bear.
So what does that look like when you're doing that at scale and you're helping manage? populations, what does a great year look like if you've done this and things are going really, really well? Because obviously there's a huge shortage of clinicians, especially primary care. We talked about on the rural side. I know that you have been doing quite a bit of work on rural health transformation. Just maybe comment around that and where you see this thing going and what great looks like.
Yeah, I mean, great is solving for the fact that we live in one of the most developed countries in the world where a third of our core population has no access to primary care. 100 million Americans. And I think when we uncovered the data behind that, it was a bit depressing.
Yeah.
Um, because the fact that a third of our country does not have access to primary care should be a way bigger societal problem that we're heavily investing in, way more so than we are today. And so a great year to us is we're lowering that number of Americans that lack access to primary and preventative health services. And I think that is going to be a journey. We're not going to get to 100 million. We will not, as a company, be the one that maybe closes that full gap, but we
Hmm.
believe we can participate, create ecosystem, create competition, and create focus that we can massively shrink the number of Americans that lack access to primary and preventative health services. It's no more acute than in the rural health setting.
Yeah.
Um, and I think there's been a lot of changes that have impacted rural over the last several years. Lots of
Right.
closure, looming Medicaid cuts, and you do have the Rural Health Transformation Program that'll inject $50 billion over 5 years, um, anchored around states and states' desire to create their own initiatives for how they want to think differently about rural health. Um, And it's a massive opportunity. The 50 billion is not going to replace what's lost from the Medicaid shortfalls. And so how I hope states and organizations that operate in rural health communities in these states think about it is what could the system look like and how do we put ourselves on a journey to design a totally different model in these rural communities, leveraging seed capital from the government.
Yeah.
Um, and that's going to be hard.
It's basically
And
like a large scale startup.
I hope that some think about it rather than just trying to put band-aids
Hmm.
on what's been broken, um, actually getting to redesigning how it could be experienced. How do we leverage technology? How do we leverage more ubiquitous access to broadband? How do we leverage the fact that most people have a smartphone in their pocket? Um, how do we better connect those patients to specialty care?
Hmm.
Um, whether that's an hour away, 2 hours away, 5 hours away, 10 hours away. I do believe we have still some of the best clinicians in the world that practice in the country. I think we have leading institutions, and I hope that they step up to also acknowledge the role that they can play um, in bringing a new model of care to rural America.
Yeah, I mean, it just seems like, I don't know, just kind of following your journey. You've been really boisterous about this. You've been spending a lot of time, expending a lot of energy in this. So you've sat across from probably some of the most powerful executives, leaders in American healthcare. And I guess who's the person that you've learned the most from, in a single conversation, and like what did they teach you?
Maybe two people.
Okay.
Um, I think that Dr. Mosier, who is a rural family practice physician from rural Kansas, who committed himself years ago to the betterment of rural health care and has been doing everything in his power to help organize, to help coalesce, to bring best practice to the rural communities in the state of Kansas, um, has had an eye-opening perspective to me from someone who's born, raised in rural America, a clinician in rural America, someone who has committed their life to rural America, to understanding the unique challenges that exist in rural America. Um, in rural America, there is a skepticism and a lack of trust in a
Hmm.
lot of the big players.
Hmm.
And that could be big players in healthcare. That could be the big institutions in their particular state. It could be the big companies that exist in the country. But um, it's a very local and a very community oriented and organized, and they build trust on relationships. And it's not to say they don't value help from outsiders, but there is a bit of that. Who's this person coming from the outside to my community to tell me what to do? And so that has shaped my perspective in this model to say, in everything that we will do out in the Rural Health Transformation Program, we will be bringing those that are both patients, consumers, but also the care teams, the physicians into the mix to design what does this
Mm.
need to look like? They
Right.
need to be part of building the solution versus somebody comes and brings the solution to the market. I don't think that's going to work in rural America. Um, and then I think there's been several others along the way that I've had some interesting encounters with. You know, Dr. Mehmet Oz over at CMS. I've spent a good bit of time with him in the last 6, 9 months. Um, and I do believe he's built a strong team. I think he is enabling his team. I think he is leading uh, with a North Star of improving care, of improving how patients experience healthcare, and of trying to tackle some of the biggest structural challenges that we've
Mm.
created in our healthcare ecosystem. I do not envy that job.
Yeah.
Um,
Yeah. Same.
politics and policy is a bit of a new world for me. Um, but I do think he's trying to take feedback from constituents um, and more broadly being out there and accessible to constituents than I've seen others before. And I think he's got a North Star of actually influencing care at an N of one patient level, which excites me. So
Yeah.
I get some energy that I think there's a lot of complicated policy um, and leading in times like we've got right now is very challenging. It's a very polarized environment that we
Hmm.
collectively live in. Um, but I do think that we are going to continue to need folks that step into government leadership in this administration and beyond that are going to be willing to tackle the hairy underlying systemic challenges that have kind of led to the problems that we've talked about trying to solve today.
And before I forget, um, tell people like where they can follow you, your work, the work of Lumeris. I just want to make sure that we kind of give you guys that opportunity to share a bit of your commercial.
Well, anybody who's interested in joining our journey, we're always looking for good folks that want to provide input and or officially join us on this journey. You can find us at Lumeris, Lumeris.com. I love to write and engage individuals on LinkedIn, and you can find me on LinkedIn. I've got a very simple handle. It's just linkedin.com/John B. Fryer. Um,
Awesome.
and that's where you can find me. But I appreciate this forum, Michael. I think it's amazing work that you do, bringing experiences. I've always loved listening to your interviews. I would encourage anybody that's listening to this to reach out I think the value that community broadly can provide as we all try and solve problems in healthcare, that's really where the sweet spot happens is
Right.
collaboration.
That's right. That's right. Appreciate you saying that. And last question, because we started off by you started your career because of one conversation with one person who changed the trajectory and asked you a simple question, why not healthcare? And if you could ask that same question, maybe to every young person coming out of university right now, considering this industry, what is the version of that question that you would ask them?
What is the version of that question I would ask them? Um, I think the way that I'm fortunate to be engaged with the John Hopkins and the Bloomberg School of Public Health, and some of the brightest minds. Now, many of those folks have already kind of seen the light, and they're in healthcare. I think the one question that I ask young people is, what the world needs right now is creative, strategic thinkers that want to tackle big problems. And there is nothing more personal than our health. And there is nothing more impactful than being able to be creative, be strategic, be disruptive, be innovative, be a solutionist mindset
That's
in
right.
an industry like healthcare. And I think there are enough avenues in healthcare, whether you like technology or clinical or finance or supply chain or patient experience or patient education. There's so many different ways to participate in the industry,
Mhm.
and there's not a one of them that wouldn't benefit from a creative, strategic, innovative, solutionist mindset individual that wants to build, grow, learn in an industry that is healthcare.
Yeah. Yeah, I think after this conversation, I'm more convinced that none of this ever gets solved with tech alone. I think we all kind of knew that. It gets solved by people that are proactive, that are willing to sit across the table, from whoever that might be. Maybe it's across the table from a health system or a payer, or maybe even it's a rural provider, and you're going to be in that conversation and you're not leaving until you figure something out, or at least sketch a solution of, all right, what are we going to deploy, by when, and let's come back again. Let's have this cadence. So that's kind of what I'm leaving from this conversation is there's just a whole string of things that need to happen in order for something to really get done at scale. And it's never as easy as or as nice as it sounds when it comes off of the press release. There's a lot of sweat equity that goes into the behind the scenes that no one ever sees, difficult conversations that have to happen. You can you can still disagree and still be friends, still be nice, and both want to move towards something that everyone wants. So that's super interesting. So for those, if you've listened to this and you got value from it, number one, the best thing, if you're thinking about, well, what can I do to be helpful? Number one is share this, like it, comment on it, tell us what resonated with you. What are some of the things that you're working on? We want to know. And if there is a topic that you want us to explore, or even a leader that you want to hear from, drop us a note, leave a comment. We do read, we do listen to them. This is a platform that isn't just about content, it's about community. A community is a living, breathing ecosystem, and sometimes you got to feed it more than what you take from it. And that's the way of doing it. So thank you for listening, John. It's great to have you come on. Keep building with purpose. And I guess, folks, we'll see you next time on the Advancing Healthcare Innovation Show.
Thanks, Michael. It's been a pleasure.